This is Jen and Nikina on eyesurgeontalks, and I wanted to do a short video about what is normal after eye surgery. When people have eye operations, there are lots of things they're worried about afterwards, because this may have been the first time they have had anything like this, and there are potentially lots of worrying symptoms after the operation which get people concerned. But also, most of them are actually quite normal. So, it is quite common to experience some grittiness or scratchiness in the eye after an operation, and this applies to all eye surgery, from cataract to retinal operations, to glaucoma operations, to squint. They are operations, and so there are little wounds and scratches on the surface of the eye which need to heal. They usually heal quite quickly, and so the feeling of the grittiness and the scratchiness should gradually fade, usually over the first few days. Sometimes you get quite an intense, sharp, prickling pain, and this will happen early, usually in the first day after the operation. And this is a consequence of dryness on the surface of the eye. When we operate on the eye, we do keep the surface moist, but it's never as perfect as your own blink reflex, and so the eyes do get a bit dry during an operation. And so if you're getting that sort of intense, scratchy, prickly feeling, using your post-operative drops will help, but also some lubricating drops are a good idea to put a few times a day, which will help soothe things. And the good news is that this sensation usually settles quite quickly within the first day or so. The other thing that people notice sometimes are floaters in the vision, and this applies in particular to cataract surgery, but also to retinal surgery. So you may see things moving in the vision that are new that you haven't noticed before. In this case, these are usually not worrisome, and they usually settle with time. But if you do get a sudden rush of floaters that are definitely new, especially if you're getting any flashes of light with it or any part of the vision that is blurry and doesn't change and doesn't get better, that it's important to let your operating team know, because they may need to check the retina and the back of the eye and make sure everything is fine. But a few floaters just drifting around are quite common. The other thing that people can feel is an ache in the eye, often associated with a sensation of sensitivity to bright lights. This may be related to inflammation, which again is quite a normal thing after having an operation, and you will often have some drops to help settle this down. So this ache should gradually tail off and settle over the first few days. If the eye is getting more achy after surgery, so the pain is not settling but getting worse, that is definitely something you should flag up with your team immediately. And also, if you're feeling sick or nauseated, or if you are sick, you should definitely tell your team, because that can sometimes be a sign of raised pressure in the eye, which can be something that happens after eye surgery, and this will need treatment quite promptly.